We're at the IAS, we're talking to Mandy, who's with the Global Action Advocacy Partnership, and we just completed a press conference, and you're kind of going to give us the report summary,
Yes.
the take-home message.
Yeah, so Action's report from policy to practice, how the TB HIV response is working, examined what's happening at a policy level in the most high-burden TB HIV countries, and whether or not that's actually translating into changes on the ground. And we found that two really big findings. And the first is that the burden to implement TB HIV collaborative activities, things like making sure that everyone with HIV is screened for TB and vice versa, the burden to carry those activities out really falls on TB programs, which are heavily under-resourced compared to their HIV counterparts. And the second big finding is that while policies have improved over the last few years, that these policies haven't translated into real change at the facility level. So if you or I were to go to a clinic in Swaziland, even if the policies maybe written down are very good, we wouldn't necessarily have the experience that really needs to happen on the ground to make sure that all people affected by both TB and HIV get the care that they need and deserve.
So how can we change that?
Well, I think it starts with making sure that national TB programs and national HIV programs work better together and collaborate. Even things such as having joint national strategic plans can be very useful. Sometimes the programs are actually on different floors of the same building and don't even hold meetings together.
Oh my God.
So, and then there's really a lot that governments can do to invest more domestic resources in fighting TB and HIV. As we start dealing with the issue of donor transition out of countries, especially those that are now middle income, it's really going to be important for countries, governments to step up to the plate and fill those gaps and make sure that they're providing the services, health services that their citizens deserve.
Is it not difficult? Is it difficult to explain to those policymakers and the implementers, as it were, how much more efficient it would be to have them work together?
I think on a surface level, everyone agrees, but when it comes down to resources, that's when things get complicated, and no one wants to share their budgets because, you know, national HIV programs and national TB programs are both underfunded. And the idea that you would have to divert resources to something else that hadn't been planned for is a hard argument to make. So I really think the best option is to make sure that country governments increase health budgets to work on these issues.
Okay. Is there any other messaging that you need to get out? Because I know you're policy oriented, and that's important, but we have to deliver the policy and expedite it. Because as times are flying on and people are dying, we can't lose more lives.
I think the real message I want to get out is that TB is everyone's responsibility. That TB is the leading killer of people with HIV. It causes 1 in 3 AIDS-related deaths. And so we cannot win the fight against AIDS without addressing tuberculosis. And what's the point of getting someone on treatment and having them live into their golden years only to have their lives snatched from them by a completely preventable and treatable disease, tuberculosis? So it's time that I think the HIV community and the TB community come together to address this deadly duo of TB and HIV.
This may be the opportunity to get some on-the-ground people who are living with the challenges messaging, such as that we can deliver a video interview like we're doing here. I know that we're talking to the people who are like leaders in the field right now, but sometimes the people who are living with the disease are more effective at communicating the messages too.
Much more effective. And so as part of our research, We conducted over 70 in-depth interviews across 6 countries in 4 different regions of the world, and made sure that we heard from people who were most affected by the diseases, people who had been former patients, affected communities, and they actually are able to give some of the best information about what's really happening at a facility level.
Yeah.
The reality. When you talk to a facility manager at a clinic, they have a message they want to give, and they're doing the best they can with the resources that they have. But when you talk to someone who, went years with undiagnosed TB, when it was very clearly TB, they had all of the symptoms: night sweats, unexplained weight loss, high fever, cough with blood, and they were put on malaria treatment because of their fever. It seems quite ridiculous. And so hearing these stories and hearing how things could be improved is really important. And a big thing that really needs to happen on the ground is pushing for better collaboration between the HIV care providers, health workers, and the TB health workers, who don't necessarily work together. So even if a clinic for HIV and for TB is located in the same facility, the TB clinic may be open Monday and Wednesday, and the HIV clinic Tuesday and Thursday. So people are going at different times, different months, different weeks. Wasted resources. It's inefficient, and it's not the way to move forward, and it's costing lives.
Well, I wish you well with your mission, because it's a worthy mission. And I hope that we made a difference here with just this little bit of an interview. Thank you so much.
Thank you so much.